Chest pain. Chest pain is badass. It can be badass. So right now, I'm going to put him on non-rebreather 15 minutes as a precaution. And that's my breathing. I thought, does my patient need oxygen? And if so, how do I administer it? I got him on O2. Now I'm going to move into circulation. This is where we'll really start telling if everything's okay. Sir, I'm going to take a capillary refill. Check, make sure okay. Cap's good. No obvious signs of bleeding externally. Pulse is good, not irregular. It's strong. I can tell that the heart's doing what it's supposed to be doing. So I'm going to look for other causes. And skin signs, of course. Touch of skin. He's warm, normal, dry. We're good. Now I move on to the next one. A, B, C, D, disabilities. Sir, do you have any disabilities or medical conditions that I should be aware of?
I'm on blood pressure medication.
Blood pressure medication, have you taken that today as you're supposed to?
Yes.
Okay, great. No obvious signs of deformation, everything looks intact. No neurological deficits, no facial droop. Everything sounds good. He's doing all right. So I'm going to move on to A, B, C, D, E. Expose, visualize, and palpate. We're going to take a look at his chest. Make sure everything's intact. We'll start with the top of the clavicles. Make sure everything's fine, ruling out any physical signs. We're going to check the sternum real quick. Intact. Deep test. Take a deep breath, sir. Ribs are intact. Take a deep breath. Fantastic. Everything's good to go. A, B, C, D, E. Expose, visualize, and palpate. That's all done. F. Formulate a field impression. Arrived on scene to find a late 40s male sitting phallus position eating peanuts. Complained of chest pain. We put him on O2 15 liters a minute for a non-rebreather as a precaution. No findings of any trauma. We're going to assume this is medical in nature. I'm going to continue into my secondary assessment. I indicate right now, because his vitals seem stable enough, that he's going to be a code 2 transport. If it does turn, I'm going to turn into, if something's wrong, I'm going to turn him into a code 3. Now we'll run down our sample OPQRST. Sample. Signs and symptoms. So, sir, you said you're having chest pain. Anything else bothering you right now? You have any shortness of breath?
A little bit.
A little bit? We already got him on too. Okay, so now I'm thinking there's something serious may be going wrong, because chest pain associated with shortness of breath usually indicates something severe. So, any allergies you have? Any
Salted peanuts?
salted peanuts? Can I have a salted peanut, sir?
You're dry roasted.
Gonna hit you. No allergies. Anything?
No.
Food bugs, drug bugs?
Ginseng.
Ginseng, you have an allergy to ginseng?
Yes, I do.
Have you had any ginseng or peanuts today besides those peanuts that you're eating right now? Okay. All right, medications. He already said blood pressure medication. I want to know what else he's on there. So you said that you're allergic to ginseng. Are you on any medications right now that you're taking every day? What then?
No. Actually, yeah, Lipitor.
You're on Lipitor? Is there anything else you're on right now? Do you take a multivitamin? Do you take an NSAID every day? Baby
Birth
aspirin?
control?
Nope. Nothing like that? Nope. Nope. Until taking sexual enhancing drugs? Nope. Okay, cool. So,
Why?
well, why? Lower your blood pressure. Lower your blood pressure and it causes.
I mean, why would I take them?
Why would you take it? He's married. What do you need?
When you start that sign and symptom, wouldn't you ask him also, I mean, is the O2 help right there?
Sometimes you can, but right now I want to get through this as fast as I can to make sure I'm not missing anything super important or vital to what's going on. So, it may be too soon, depending on how fast you move. It may be too soon for it to start having any immediate effect. Sometimes it has a comforting effect, but that's about it. So
I will say though, I know this is a demonstration, but as a patient, you talk too fast.
oh yeah, I'm blasting through this. Medications. So find out any medications are on.
Right.
Pertinent past history. Sir, have you ever had experienced any chest pain or
Never.
shortness of breath before? This is the first time you've ever experienced something like this.
Yes.
Okay. Have you ever had any heart surgeries in the past? Have you ever had any major surgeries doing with your lungs or your chest?
No.
No. Nothing like that. Goodness gracious. All right.
It's like a
No,
joke.
no, I'm fine. Pertinent past history is done. We're going to move on to SAMPL. When's the last time you had to eat or drink anything, sir? Is that some peanuts right now? What else? You been drinking today? It's the day after 4th of July.
Yeah,
Nobody
no,
will when he
I was
leaves.
pretty good yesterday.
Did you? All right. So that way we know he may be having delayed heartburn from yesterday, the last order thing, and then we go events leading up to it. Sir, what were you doing before this occurred to you? Were you running around?
Taking this really stressful test.
Taking a really stressful test. Do you think that cost you? Now I'm going straight to OPQRST because this is medical. Do you think taking that really stressful test caused you to have this chest pain and shortness of breath?
I did start to feel bad.
Have a headache while you were taking the test? Okay, so does anything make that feel better or worse?
Yeah, I see it.
After I realized I passed it, I felt a lot better. Oh, good. Quality of pain. Sir, tell me what it feels like to you.
Just a low grade pressure.
Low grade pressure in your chest and a little bit of pressure in your head too?
Right.
Okay, is it OPQR, region radians recurrent? Sir, point to the chest pain. right in the center of one finger. Can you point to it where it's the most, right in the center of the sternum?
Right.
All right, does it spread anywhere? No, it stays right there. Okay, does it come and go? Does it throb?
No, it's just a continuous dull in the background.
In the background. Okay. On a scale of 1 to 10, 10 being the worst, the most pain you've ever experienced in your life, go ahead and rate this pain for me.
Maybe a 2.
Maybe a 2, so it's just a mild something that you were kind of concerned
Just
about.
doesn't feel right.
Yeah, you've never felt it before. Great. How long have you been experiencing this pain?
Hour and a half.
Hour and a half? All right. So now here's the crazy thing. I've done my sample, I've done my OP-QRST, I've determined that there was pressure in his chest for over an hour and a half. Well, with cardiac, the crazy thing is, if it's angina pectoris, sometimes people can get angina pectoris where the heart becomes ischemic, loses a little bit of oxygen. If it goes over 30 minutes, is when we start getting concerned. He could actually be experiencing a heart attack, even though it's low grade, depending upon somebody's age and neuropathy and other contributions of conditions they may have. It may be saying that the body's having a heart attack, even that low pressure, like a 1 or a 2. We've had people come in and go, yeah, I just don't feel right. I had trouble breathing. You know, I was running around with the grandkids, and now I don't feel so good, right? And they're having a full-blown cardiac
Maybe he
event.
needs that firefighter to slide down from the pole and
Yeah.
give him
Anyway,
some gummies.
So that was the run through.
You asked him about his medications.
Yeah.
You also asked, are you taking them, and are you currently taking them?
Yes.
He did. Now, if he said, yeah, he did. So my question is this, he said, yes, I did. Would you want to see his medications?
Before I left there, I would get his medications.
Okay, make sure you tag them along with you.
Yeah.
I take them at home, they're not.
And you wanna look at.
They're not here?
You
So-
wanna look at their current, and they're his.
Yes.
Or hers.
Yes. Sometimes people take stuff that's not for them. That's more for abusive medications that give them some sort of
I actually have
higher
pictures
level.
of my medicine bottles
Uh-huh.
in my phone.
There you go. You know, a lot of times people have the medical thing. I just found out that my Kaiser stuff, you can access it without getting into unlocking my phone.
Mhm.
And it has all my medical information, all the
there's
medications
Yep.
that I'm taking,
on
and,
the iPhones.
you know, recent surgeries, etc. So, cool. You guys have any questions about that
Did you
stuff?
miss anything?